I just burst out laughing. It was one of the busiest days in a long time, and it just cranked me up. I was laughing, the whole department burst out laughing. So that, I think, I remember as the funniest moment I've had till now.
Navigating through NEET MDS counseling can be a very confusing and challenging procedure because you get so many doubts about which branch to choose, how to choose it, and which one is the best one for you. But don't worry, in this episode of Tooth Talks, Navigating Your Dental Journey, we are going to demystify the same. So let me quickly introduce myself. I am Dr. Ichita Joshi, and before diving deep into this session, I would like to take a moment to thank Cuspyd, whose efforts make this show possible. So Cuspyd is an evolving EdTech company who's putting in a lot of efforts to make fun and interactive and educative content for you all. Our special guest for today is Dr. Soumya.
Hi, Ichita.
Ma'am has done her BDS and MDS from Army College of Dental Sciences, and currently ma'am is practicing as a consultant pediatric dentist across various clinics in Hyderabad and Secunderabad.
Thank you so much, Ichita. Thank you for the lovely introduction.
Glad to have you here, ma'am, and we're really looking forward to dive deep into the branch of pediatric and preventive dentistry and getting some great insights from you. So that makes me curious to ask you the first question. And that is, ma'am, what made you choose this branch, and what all do you like about this branch?
So I think if I rewind back to the days when I was a kid, I think I myself was scared of a dentist, and I thought, this could be better. As I grew up and started learning more and more, and destiny had it maybe, like I ended up becoming a dentist. And when I was posted in the Department of Pediatric Dentistry, I saw how my seniors would handle, even the crankiest of kids, or do toughest procedures in a very, cranky child or child who is crying in the best possible way. And at the end of it all, the child would leave with a smile. So that is something which excited me so much that yes, this is a reality. This can be a reality. This is a possibility that, dentistry or going to a dentist could be, a fearless thing to altogether. So then it slowly came to me that, I think this is what I really want to do. And I would like to say that the joy of being a pediatric dentist is, unmatched to any other, because you treat little kids whose love and any kind of emotion is very unfiltered. So I think that is what made me want to select pediatric dentistry.
Obviously, pediatric dentistry is a very vast and beautiful field altogether. But that brings me to this doubt, very common doubt, which even I had when I was a BDS student. If someone is not good at handling kids in BDS, can he or she join this branch? What are your thoughts on that?
Oh, definitely. I think anyone and everyone can join this branch. I don't think how you fared as an undergraduate should be a marker for how you want to, pursue your post-graduation. So I think that first of all, MDS is a 3-year course. So it teaches you, it equips you, it gives you the skills and the tools that you require to manage children of all behaviors. So behavior management and various techniques are a very integral part of pediatric dentistry. I would say that during the 3 years of MDS, all pediatric dentists undergo extensive training in child psychology as well. So we learn, understand, and apply the techniques that we learn in child psychology and the area of behavior management to our daily practice in order to make the whole experience more child friendly. Coming to a dentist should not be fearful for anyone. I think creating a positive dental attitude right from the time when the child comes in for the first time has a long lasting impact. You need to have the will to learn, and I think you will definitely succeed.
Okay. And that is a big relief to hear, and I think that will encourage more people to go forward with this branch. So suppose, ma'am, someone chooses this branch, pediatric and preventive dentistry. So what all is taught in the MDS curriculum in first, second, and third year?
I wouldn't want to demarcate that this is a procedure which is taught in first year, second year, or third year. But just to give you a general overview, the first thing that you would have to learn as a pediatric dentist, as a budding pediatric dentist, would be to differentiate between primary and permanent teeth. I think that is the most basic thing that you have to start with learning. Then slowly you build on it and you learn how to read x-rays of, various age groups, and then how to diagnose different kinds of cases, your general endodontic and conservative procedures. You will also come across some myofunctional orthodontics, which we practice. And nowadays, I think we are shifting our mindset towards preventive dentistry so much more. So I think you have a lot of preventive procedures which happen. Apart from that, we also have a very unique area where we specialize, which is the area of children with special needs. I think we learn to cater to them, to their needs. And I think that is a very unique thing which we learn as pediatric dentists. Apart from that, you have various types of sedation which are used in regular practice that are taught. And then you have certain cases which we perform under general anesthesia, under a hospital setup. So these are all the varied amount of cases that you will encounter as a pediatric dentist throughout your years in MDS.
Okay, ma'am. So it's really amazing to see that you get to learn so much in your MDS curriculum in 3 years itself. So before moving on to the next question, have you checked out Cuspyd's latest Instagram post where they put out weekly MCQs and book recommendations? Do follow their Instagram page for more such fun and engaging content. Coming back to this show, ma'am, can you tell us what all procedures you get to practice as a pediatric dentist?
As a pediatric dentist, I get to practice a varied variety of procedures, even within the span of a day. So, right from preventive procedures like fluoride application, pit and fissure sealant application, and restorations, extractions, performing pulpectomies, pulpotomies. So there is a wide variety of cases that await you: space management, stainless steel crowns, aesthetic crowns, and a lot more. This is just a small glimpse of how a day looks like, probably in a busy day looks like. I don't think there is a lack of any case. I think what is required now is more and more awareness among the parents, and the younger generation. So we as pediatric dentists also hold the responsibility of educating and making the parents aware. A lot of people are not aware. I think awareness is what is lacking nowadays. Apart from that, once you have the trust of a child and of the parent, I think they are your patients for life. Monitoring their growth, nutrition, their sleep cycle, their airway, a lot of factors. I see a lot of parents coming in very early. They notice even a small change in their child's either behavior pattern or anything. They do come to a dentist. They do take it into consideration and they come looking for a pediatric dentist in specific, which I feel is a very, a positive change in the whole scenario.
Right, ma'am. Awareness definitely plays a big role. So coming to a question related to this, after you do your MDS and you set up your practice, what kind of patient inflow do you expect?
Well, depends on the kind of practice. So if it is mostly consultation based, so it depends on the clinic mainly, I would say. There are also pediatric dentists who have an exclusive practice. What an exclusive practice is, it is a clinic only and only for children. So it is more kid friendly, I would say. The environment is not overwhelming for a child. The tools, techniques, the behavior of the staff, everything is very child friendly. So I think that that is the kind of practice that we all should move towards. But I think it's a personal choice. So you have practice of all kinds. Then apart from that, this is just the clinical aspect of it. There is a whole big aspect wherein you have research, you have academics. So all that is not to be missed out, right? You have positions starting from your senior lecturer up to the position of the head of the department. That can be a very interesting side to quite a few. Apart from that, I think research is a big area. I personally, I'm more inclined towards clinical practice. So I think doing MDS gives you a fair idea of a little bit of everything. How scenario will look like if you're practicing as a clinician, how your scenario looks like if you are an academician or if you are into research. So whatever interests you, I think MDS is a wide open field which gives you the area and the time and the kind of exposure towards everything. So I think you get a taste of everything, then you see what your calling is and you go in that direction.
All right, ma'am. So you gave us some great insights about the clinical aspect. Now I would like to ask you something related to the academic part. So ma'am, I have heard that you have won a prize in the scientific poster presentation in a national conference. So ma'am, would you like to give us some tips about how to present a paper or a poster in such conferences?
When I was doing my MDS, we had the opportunity to present a poster and we won the first prize for it in a national conference. To summarize the whole experience, I would say the first and most important thing would be to select a good topic. So now you don't have to select something very advanced and out of the world. No, you need to select something which is relatable, which is relevant, and select it well and make it unique, make it yours. See, now there are a limited topics, there are a limited range of topics. So out of that, you might pick a topic, the same topic might be picked by another person. There are so many pediatric dentists, right? So what do you bring to the table? What is your perspective, or what is your insight, or what is your take towards that topic is what makes your poster unique. The second would be, I would say, since it's a national conference, you're competing. So I think you should have a very unique name, or unique or very catchy, something which grabs someone's attention that, they have to turn back and look towards a poster. And well, all this pomp and show is not the only thing which is required. You have to research it thoroughly. I think that is what builds the foundation of your poster or your paper or any kind of research. I would say your thorough research. Go to standard journals, look into them, read them thoroughly, research some more. We have all the tools and technology today, right? So it's very easy for us to type a few things and we can get so many results. So I think we should take advantage of that and do a very thorough, strong research. If your poster or a paper is backed by good research, I think it is going to give you more points. And apart from that, nowadays you have all these great softwares where you can find these very creative templates. I think, for example, Canva. You can design a very nice poster using all that. So, life has become easier. So I think we should take advantage of the tools which are provided to us nowadays, all thanks to the technology. On the day of the presentation, first thing, as usual, you should be calm and composed, have your cool and be confident. You have done your research. It is your paper. Own it, make it yours, present it well. And I would say, a night before, practice in front of the mirror, practice in front of your friends. And while you practice in front of your friends, seniors, staff, so I would say take inputs from them. Everyone has their own perspective to add, right? So I wouldn't say take everything to heart, but everyone has their own outlook towards it. So take what is useful to you, make it yours, make it better. And I think that should make you win a poster.
Amazing tips, ma'am. I have made a note of all of them and I'm definitely going to apply it in my next paper or poster presentation. So this was all about, the serious stuff, asking questions about academics and clinicals. Now let's get to the fun part. So ma'am, I have a few fun questions for you. The first one is, what was the sweetest thing that a kid has done for you?
I think a lot of sweet gestures are made by kids. I wouldn't want to pinpoint as to what was the sweetest. Each kid is different and each kid brings with him or her their own set of joy. So I think every day is a sweet gesture day for me.
Well, that is really sweet. That's the perks of having kids around in your practice. So coming to the funniest thing that has happened to you with a kid, can you throw some light on it? I would like to hear that experience.
Oh, definitely. Funniest has to be the first time when I was very new to the world of pediatric dentistry. I was just learning to handle cranky kids and, the whole experience. In our department, we had separate cabins and there was a place where you had to walk down and go get your material. I made the child sit down so that he could adapt and just get comfortable around. And I went and got my materials. By the time I come back, I see the child is upside down.
Oh, upside down?
Yes, upside down. In the whole sense of the word, upside down, okay? And I just burst out laughing. It was one of the busiest days in a long time and it just cranked me up. I was laughing, the whole department burst out laughing. So that I think I remember as the funniest moment I've had till now.
Wow, that was very funny and I'm sure it must be a treat to watch that happening in the department.
Definitely.
So, ma'am, thank you so much. That brings us to the end of this show. To all the people who are watching, I would like you to check out Cuspyd's YouTube channel, which puts out some amazing content just like this. And we want to hear from you, students. So, do drop a comment and do share this video, because we want to know what your doubts and queries are all about, and Team Cuspyd will get back to you. So, ma'am, thank you so much for coming here. Before leaving, I have a special hamper for you. Thank you so much for coming on this show.
Ashita. Thank you. And I would like to thank Cuspyd for providing us this opportunity, this time, this space to sit down, talk, discuss. I hope it inspired a few people, or at least made you comfortable with the idea of taking pediatric dentistry as a profession. So the world of pediatric dentistry is very vast, and I think there is a space for each and every one of us. I hope to see more budding pedodontists.
So that wraps up another episode of Tooth Talks, Navigating Your Dental Journey. And I'm pretty sure there must be a lot of budding pedodontists by now. So see you in another episode, and take care. Have a good day.